My dear colleagues, my dear friends, and of course my students, residents, and fellows, welcome on MuniMeterHealth, your source of learning cardiology and about human heart. I'm Dr. Jaitly, your cardiologist. We are enhancing medical education, as you see, simultaneously patient education as well, in order to improve the health literacy and thereby improve the clinical outcomes. And that has been shown worldwide now that the clinical outcomes are totally dependent upon how well we can enhance the patient health literacy. So welcome again. I'm Dr. Jaitly. This is MuniMeterHealth, your source of learning. In this brief short video, we're going to be talking about what are heart murmurs, just the important ones. There are numerous heart murmurs. We'll try to cover the most important ones here. Now remember, the heart sounds are lub and dub. So we'll write lub and the dub that occurs. So this is your S1, which is lub, and S2, which is your dub here. Okay, so lub dub. There's a gap, that's diastole. So that's a longer period of diastole as opposed to systole. Systole, the time period between lub and dub is shorter than the dub and lub, because lub comes here now again. So lub dub, lub dub, lub dub, lub dub. That's how it goes as the first and the second sound. Okay, so heart murmurs are abnormal sounds that occur between the normal sounds, which are lub and dub, related to either the increased turbulence across the valves, like I've shown you here, the valves here, or increased flow across the valves, either because of regurgitation or incompetence on the valves, or it's because of a stenotic valve or a narrowing of the valves. So once again, increased flow that occurs across the valves as either because of regurgitation or because of stenotic nature of the valves. They can also occur in increased hyperdynamic flow, like in severe anemia, thyrotoxicosis, high output failures. I'll refer you to other videos pertaining to those conditions. But just so that you know, any increased flow or across a valve leading to a turbulence, whether it is because of stenotic nature of the valve or the regurgitant incompetent nature of the valve, will result into these heart murmurs. So let's define what are systolic heart murmurs. Well, systolic heart murmur, one classic example, which is a prototype I've shown here as number one, is the pansystolic. Now, what do you imply by pansystolic? A pansystolic murmur occurs at the onset of S1, which is the lub. So you will not hear it because the mitral valve has not closed fully during the left ventricle. It's contracting. So as the left ventricle is contracting, the mitral valve normally closes. But in this setting, it's not closing and the valves stay open, and one gets a regurgitation, and the regurgitation will occur in this direction like that. And that is called mitral regurgitation, as I have pointed out. If it occurs on the right side, it's called tricuspid regurgitation. So both these valves conditions, tricuspid regurgitation and mitral regurgitation, will produce a pansystolic murmur. And how will this sound like? I'll try to mimic here. So they have one intensity, and as you see, they have one intensity all along during the systole, and of course diastole is quiet. Moving on to the second variety. Now, what is the second variety? The second variety is the diamond-shaped mid-systolic aortic stenotic murmur. Now, the classic example here is aortic stenosis. Why? Because the valve is starting to show stenosis at this position, because this is your aorta, and the onset of the aorta, right here, the aortic valve, and that is stenosed. So there is increased turbulence, and the left ventricle is trying to eject out into the aorta. As a result, during the early systole, there will be an increased flow. It peaks all the way to the top. Likewise here, it will be recorded in this fashion, and then it descends. So the diamond-shaped mid-systolic murmur will sound something like this. So that's mid-systolic murmur. And that is the typical systolic murmur or diamond-shaped murmur of aortic stenosis that occurs because of the stenosed valves, an increased flow across the aortic root, which is causing a great deal of turbulence, while the left ventricle is hypertrophied and trying to send blood into the aorta. A third variety we come to is the diastolic. In the diastolic section, now let's do what's going on in diastole. So obviously diastole is between S2 and S1. So dub and lub. So this becomes your dub and this becomes your lub. So lubbed up, lubbed up, lubbed up. So dub, between dub and lub there is an increased period. Obviously that's your diastole. Now the classic example here would be a pulmonary regurgitation murmur or an aortic regurgitation murmur. A pulmonary regurgitation murmur will occur at the pulmonary valve, and aortic regurgitation will occur at the aortic valve here. So this is when the ventricles are relaxing. When the ventricles are relaxing, and if there is a pulmonary incompetence, the blood will flow back into the right ventricle from the pulmonary valve, and if the left ventricle is relaxing and the aortic valve was incompetent, the blood will flow back into the left ventricle. And how will that sound? Again, it depends on how acute in onset is the AI or the PI, we call it, aortic incompetence or pulmonary incompetence. But the very fact is it lasts throughout the diastole. So there is a higher intensity because the the pressure across the valve is highest at the aorta during the onset of diastole, and as soon as that occurs, the blood will start to the murmur will decline towards the end of diastole. How will it sound? It sounds like a blowing, like you're blowing across an open bottle. See how it descends into intensity. So that's a blowing decrescendo murmur, we call it, because it decreases as it goes in intensity from the higher intensity to lower intensity between S2 and S1. The fourth variety is, and not the least, but it's very important, is the mid-diastolic rumble and with the presystolic accentuation that is a typical of mitral stenosis. So here the murmur is occurring at this level, the mitral valve. Now the blood is normally, as you know, left atrium empties out into the left ventricle in diastole, but if these valves are very, very stenotic, what will happen is there will be increased turbulence. The left atrium will increase and try to empty it out, with force into the left ventricle. And because there is a presystolic accentuation because of the left atrium kick, we call it, there is a presystolic accentuation right at this level. Sometimes one can also hear an opening snap between the S2 and the onset of the murmur. There is an opening snap. We call it OS. And the narrower the OS S2-OS interval, we call it S2-OS interval. The narrower the interval, the greater is the intensity of the mitral stenosis, and vice versa. If the opening snap is moving inwards into diastole in this fashion, then if the murmur starts here, then obviously mitral stenosis murmur is very, very mild. So how will it sound like? Again, you'll have a mid-diastolic rumble and then a presystolic accentuation. Now, listen to this. So that's your mid-diastolic intensity and then a presystolic accentuation again at the onset of systole, because remember S1 is beginning here, just about to begin here, so there'll be a presystolic accentuation because of the atrial kick, or the left atrial kick, we call it. Okay, so these are your four typical prototype murmurs I try to sort of quickly define. A pansystolic murmur, classic example, mitral regurgitation on the left side. A diamond-shaped mid-systolic murmur, a classic example is aortic stenosis. A blowing decrescendo murmur, classic example is aortic regurgitation and pulmonary regurgitation on the right side, of course. And then you have the mid-diastolic rumble with a presystolic accentuation that is classically heard only at the apex, if you will. And then, of course, the patient is in the left lateral position, and sometimes it's only heard best with a bell of the stethoscope. So remember these things. So bell of the stethoscope, the patient is, you're auscultating at the apex where the apex beat is. Sometimes you can feel a thrill depending upon the severity of the mitral stenosis. And of course, in the left lateral position, it's best heard. Okay, and that's a mid-diastolic rumble of mitral stenosis. So folks, these were the four prototypes of your very important murmurs, and of course there are very other important murmurs as well, but that's beyond the scope of this very short video. Our attempt is to try sort of prepare you for the exams, the boards, especially the students and residents and fellows, and of course so this way we understand the again, I do refer you over to my other videos where I've discussed valve stenosis and valve regurgitations, so you can combine that information with this. But again, there's no shortcut to the textbook of cardiology that you're following, that your university is prescribing to or subscribing to. Just remember that you have to read the text, but these videos are only supplement and not a replacement to your text of cardiology. Once again, we are happy to bring you this information in a nutshell in these very short videos. My name is Dr. Jaitly, your cardiologist on MuniMeterHealth. Stay tuned for more as I come back again on a different video and a different subject again. Goodbye.